knock on the door, provide privacy, wash my hands. My name's Heather. I'm going to be your nurse today. I'm going to be doing a cranial nerve assessment. The first cranial nerve is the olfactory nerve. That test I could perform would check the sense of smell. However, I'm not going to be doing that now. Cranial nerve number 2 is the optic nerve. So I'm going to check your field of vision. I'm going to do that by placing my hand on one eye and you placing yours on the opposite side, and then we'll repeat it for the other eye. So if you can tell me how many fingers I have.
3, 4,
Then we'll do the other side.
5, 2.
Okay, I am going to also have you read from the Snellen chart. So you might have to step over here a little bit and then cover one eye. And when you do that, read from the lowest line that you can.
LEFODPCT.
Okay, that's 20/20 vision in that eye. And then do the other side, covering your eye.
FELOPZD.
Okay, very good. Cranial nerve number 2 is intact. Cranial nerve number 3 is ocular motor, and with that I'm going to be doing a starburst, checking your field of gaze. So I'm going to take my pen light. I would like you to follow my pen light up and down and in any direction that it goes. Okay, I'm also going to check your pupillary response. So I'm going to take the pen light and pass it over your eye on each side. Are you ready? Okay. Pupils are equal, round, reactive to light. Cranial nerve number 3 is intact. Cranial nerve number 4 is trochlear. And I'm going to be checking accommodation. I will do that by having you follow my pen light inward and downward as I move it towards you. So, cranial nerve number 4 is intact. Cranial nerve number 5 is trigeminal. I am going to have you clench your teeth, and I'm going to check your masseter muscle, your temporal muscle, and I'm going to have you press against my hand with resistance. I would then also be able to check your sensation of your face, your scalp, your cornea, your mucous membranes of your mouth and your nasal cavity. However, I'm not going to be doing that at this time. Cranial nerve number 5 is intact. Cranial nerve number 6 is abducens, and I already checked cranial nerve. When I checked cranial nerve number 3, I checked your EOMs, and that checked your lateral vision. Therefore, I do not have to repeat that. Cranial nerve number 7 is the facial nerve. So with the facial nerve, I would like you to chew. So checking mastication, and then open and close your eyes. Also, if you could smile, frown, and puff out your cheeks. I would also check taste by sweet, salty, or sour substance, and I could also check tears and salivation. Cranial nerve number 7 is intact. Cranial nerve number 8 is the vestibular cochlear nerve. And I am going to do a whisper test. So I'm going to obstruct your hearing in one ear and say something over here, and then I'm going to do it on the other side. And you're going to repeat what I said to you out loud.
Blue, black, yellow, and orange.
I would also check equilibrium, and I would do that by a gait test or by a full head-to-toe assessment, but I'm not going to be doing that at this time. So Cranial nerve number 8 is intact. Cranial nerve number 9 is the glossopharyngeal nerve. So I'm going to get this glove here because I have to check your gag reflex. But what I'm going to do first is have you say, and then I'm going to check. So gag reflex is intact. Cranial nerve number 9 is intact. Cranial nerve number 10 is the vagus nerve, and with that I would like you to say your name, your date of birth, and if you could swallow.
Alexis, 7199.
Cranial nerve number 10 is intact. Cranial nerve 11 is the spinal accessory nerve. I'm going to have you move your head from one side to the other, nod up and down, and shrug your shoulders against resistance, which will be me kind of gently pushing one way or the other. Okay, and we're going to shrug your shoulders. So cranial nerve number 11 is intact. Cranial nerve number 12 is the hypoglossal nerve. So I'm going to have you stick your tongue out to check, stick your tongue out midline, and then I'm going to have you stick your tongue out right and left side, checking for any variance. So if you could do that now. Okay, cranial nerve number 12 is intact. This concludes my cranial nerve assessment. Thank you.